Well, we follow a lot of different metrics. The one that we've been following closely and we talk a lot about are the cases per 100,000. And ideally, minimum transmission, which would be 10 cases per 100,000, 110 cases a week. We're not there yet. We're around 300 to 400 cases per week. Ideally, that is where we'd like to be as we go into flu season. It would give us really a safety net if we had to go up a lot. As you know, we just recently came out of another blip where we were up to over 1,000 cases a week. So our hope is that we'll be able to sustain where we are now and still see a dip down. There is some concern at the state level that we're starting to see a minimal increase. All of us are hoping that that will stabilize.
How much does the U of A's presence and their testing numbers complicate things here in a county of this size?
You know, I think uh, I think 2 months ago we weren't clear what the impact would be. I think now, as we've come out of this spike that we truly believe was due to the university, we've learned a lot. We're working closely with them. The impact right now is very minimal. The 15 to 24-year-old age group has seen a decrease, a very significant decrease, whereas we have the older age group, 24 and above, seeing an ongoing increase there.
Some school districts are bringing students back in for in-person learning. There was one district here in the Tucson area who did so this year, or this month rather, but we're going to see more. What will you be looking for?
So what we look for is ongoing cases, and we are working very closely with the school districts. They've been actually excellent partners. We do a few webinars a week with them. We've asked them as soon as they get one case to let us know. The state requirement is with two cases, they have to let us know. They've almost always been cooperating with us. So as soon as we get a case, we do a case investigation. Do contact tracing. We have a contact tracing team that's designed specifically for schools. So we've had a lot of luck. We haven't seen a lot of transmission from cases to the contacts. So we follow the contacts. That's the one thing we would be very concerned with. If we start seeing an increased number of contacts of cases become cases themselves, that means that we have been very unsuccessful in terms of helping stop transmission.
The schools that have reopened, what's the risk level thus far based on what you've seen in these last few months?
We've had over 100 cases reported from the schools that have been open, but they've been limited to one person. So we have not seen an increased number of outbreaks in the schools.
So if child comes down with those symptoms, do they go to their primary care or should they be tested right away?
The recommendations are a little unclear. What we are recommending is that you stay at home for at least 24 hours. If you clear within 24 hours, you're fine. Then the CDC recommendation is you can go back to school. I think the one thing I would encourage parents, though, and families is we have testing that is ubiquitous. It is really easy to get tested right now. So if you have the ability, meaning you can get to a testing site, especially a county testing site where there's no fee involved, we would encourage you to test. The more we test, the more we'll have insight into what's going on in the community.
Okay, Dr. Teresa Cullen from Pima County Health Department, thank you for your time.
Thank you so much for inviting us to your show.